I'm Anthony Carey, creator of the Core-Tex and developer of the Pain-Free Movement Specialist. A common conversation around liable or unstable surfaces are that they're often all grouped into the same category. Real quickly, I just want to give you a little bit of differentiation between some of what we have right here, which are some of the more common stuff that you might see. There's lots of different objects and tools out there that we could take advantage of, but these will be enough to help us explain the principles. Very frequently we get Core-Tex is like a BOSU on steroids. BOSU is an amazing piece of equipment, but it's an apples to oranges comparison. If you look at the BOSU and the Airex, for example, they're what we call conforming surfaces, meaning they compress or give underneath the pressure that we apply to it, right? So if I'm going to do something either with my hands or my feet on either one of those, the greatest amount of influence, initial influence and need for adjustment is actually going to come at the point that's closest to that surface. So if I'm standing on it, I'm going to do more fine tuning with my foot and ankle and the little intrinsic muscles of the lower leg before I get the gross motion up here if I start to lose my balance, or same thing with the hands. Something like the BOSU, because of its shape, actually changes things also because of the dome and that I have surface area to drop on the front or the back, which I don't get on the flat Airex pad. And if you look at sort of your typical balance board, what we have here is just one that has a single axis, so depending on how I stand on it, I can go front, back, or side to side, right? Based on the axis or where I'm positioning myself. So a firmer surface, okay, more mimics the floor, but the floor doing its stuff, where we'll get sort of, you'll notice I don't have to do as much fine tuning here, but I'll start to get a little bit more dissipation of what's necessary further up the chain. And then if we go to something like the Core-Tex, similarly, it's firm like the floor, but not only are we obviously getting the tilt that you might get on a balance board, at the same time we're also getting the kind of the rotation and the translation, all that happens at the same time. So they're all going to offer slightly different inputs and then therefore reactions from the body, but it's nice to know that we have these options, and if we want to program specifically around what each of these do, then we have that understanding of their capabilities and their limitations for that matter. Whether we're standing on them, kneeling on them, hands on them, whatever it is, we can use that to empower how we program what's best for our patients or our clients or athletes at that time.